Hi, this is Dennis with the End Depo Now campaign. I'd like to read you a letter. It was written recently by Dr. Noorchashm. He's a thoracic surgeon and a founder of the American Patient Defense Union. I think you'd find it very interesting. He wrote a letter to Pfizer regarding epidural steroid injections. Now, let me read it to you. It's pretty long, but I think you should hear this. He says here, Dear Mr. Lankler, now he's the general counsel at Pfizer, you are receiving this public alert letter from the American Patient Defense Union in your capacity as general counsel at Pfizer. This patient safety warning is being issued to Pfizer and on the public record because it has come to our attention that your drug preparation, known as Depo-Medrol, is being used off-label in large numbers of patients across the United States for epidural steroid injections, or ESIs. The ESIs using Depo-Medrol are performed liberally and widely by pain specialists across the United States without the full informed consent of patients as to the potential serious adverse neurological outcomes associated with its use in the neuroaxial anatomic space. Please note that the union represents the interests of American patients who reach out to us voluntarily for help. Our objective is to provide transparent feedback to specific providers, hospitals, insurers, and drug device manufacturers on behalf of individual patients and their families when grievances arise. The goal is to improve our nation's healthcare establishment by addressing real or perceived safety hazards and ethics violations across the United States in order to create a maximally patient-centered corporate healthcare environment in deeds, not just in words. Additionally, we are interested in identifying medical ethical violations and corrupted or unsafe practice patterns within our corporate healthcare establishments. Please note that the union is not a legal firm, but in cases where litigation becomes appropriate, we do support our members in seeking robust legal representation. To be clear, the union recognizes that Pfizer, in accordance with FDA requirements, has a contraindication for intrathecal injection and a serious warning label for epidural injection already printed on the Depo-Medrol package insert. However, as Pfizer is likely well aware, Depo-Medrol is in wide use by pain specialists for injection into the neuroaxial space. The union is concerned that these injections are occurring with an unacceptable degree of laxity, despite your company's serious contraindication and the warnings on the drug's packaging. Certainly, only a minority of patients have access to your package inserts, or are even told what drug is being used. You and your colleagues at Pfizer have clear knowledge of the range of debilitating and potentially permanent neurological complications caused by Depo-Medrol when it is exposed to the intrathecal space, as this knowledge has served to inform your package warnings and contraindications. When the Depo-Medrol slurry is introduced into the epidural space, the chance of a breach of this caustic slurry substance into the nearby arachnoid space is terribly high, be it due to mechanical traumatic injury to the dural membrane or due to a physiological defect in the dura connecting the epidural space with the arachnoid space. Therefore, with this letter, on behalf of susceptible but unsuspecting patients across the United States, the union is requesting your prompt attention and action in two specific domains. Number 1. Pain specialists at private and hospital-based practices across the United States are widely using Depo-Medrol for ESI in a lucrative practice pattern. This use of your drug is occurring in many, if not most cases, without full informed consent or even the knowledge by the patients about the use of Depo-Medrol, much less its associated neurological complications. The union is informing you, here, of its concern that your company's package insert warning is of insufficient fidelity to adequately warn patients, and that most practitioners are not informing their patients of the serious risks associated with the off-label use of Depo-Medrol. As such, the union is formally and on the record requesting that Pfizer immediately issue a direct and public warning to the American Pain Society, the American Society of Anesthesiologists, and the American Neurological Association requesting these societies to issue an absolute guidance to their members, instructing them to exercise extreme caution in the use of Depo-Medrol in ESI. In addition, it is critical that Pfizer stress to these professional societies the importance of full informed consent to their patients for the epidural use of this drug, as well as its devastating neurological complications. Without immediate input from Pfizer to practitioner guilds, your package inserts are insufficient in protecting patients through the informed consent route. With this letter, we ask that you and your company's leadership will carefully consider this action because your package inserts are functionally masked from patients across the United States. Thus, Pfizer is being exposed to a totally avoidable liability risk for permitting irreparable harm to unsuspecting patients by not aggressively and immediately guiding practitioners to exercise stringent and ethical judgment in the epidural use of Depo-Medrol. Number 2. It is likely that neurological complications associated with the use of Depo-Medrol are being underreported or misdiagnosed by practitioners and misunderstood by a significant number of affected patients, given that most patients undergoing these injections start out with radicular pain symptoms. So it is easy to see how the additional symptoms caused by Depo-Medrol would be attributed to the patient's intrinsic disease and not to the off-label use of the drug. As such, the union is requesting that Pfizer immediately initiate a prospective surveillance study to determine the incidence of neurological complications following ESIs using Depo-Medrol. Alternatively, and in order to totally eliminate safety risks to patients and liability risks to your company, Pfizer should very seriously consider placing an absolute contraindication to the epidural and intrathecal use of Depo-Medrol in the United States, and recommending that the FDA issue a similar strict guidance to practitioners. It would be a cogent and correct move on the part of Pfizer to entirely eliminate the possibility of any patient being harmed by the dangerous injection of this drug into the neuroaxial space, as has been done in several other countries. In summary, Pfizer must urgently address the fact that a vast number of pain specialists in the United States are using your product, Depo-Medrol, for epidural injections, with the very real possibility of intrathecal exposure, and without informing their patients of the potentially catastrophic neurological consequences when Pfizer's emulsion accesses the arachnoid space. Finally, Mr. Lankler, the union is writing you as a corporate leader in one of our nation's most prominent healthcare institutions. We write in order to partner with you to eliminate what is likely the cause of an underappreciated but serious harm to many unsuspecting patients using one of your products. This harm is caused by the non-stringent standards applied by the practitioners using Depo-Medrol, given the lucrative practice pattern that has evolved around its use. The union is confident that you will agree that tolerating avoidable collateral damage to a minority subset of unsuspecting patients for the real or presumed benefit of the majority is fully inconsistent with your corporate ethos and the principles of medical ethics and lawful conduct in America. Therefore, we are confident that, both from a corporate ethics and a liability perspective, you will agree that Pfizer has a duty to issue a stern warning to the professional societies charged with setting the standards of care for ESI in pain management, if not moving to entirely eliminate the use of Depo-Medrol for epidural injections. With this letter, the union and the public now consider the Pfizer leadership to be aware of what is a large-scale, inappropriate, and dangerous use of your product, Depo-Medrol, in the epidural anatomic space of unsuspecting patients across the United States. We appreciate your focused attention and public action on this issue in order to protect unsuspecting Americans across the nation. We look forward to hearing from you, to seeing you demonstrate your leadership to American patients and to the union's systemic patient safety agenda. Please do not hesitate to contact us with your questions or comments at info at patientsrights.org. Very sincerely, Hooman Noorchashm, MD, PhD, founder, American Patient Defense Union.